Okay, so a lot of fighters and a lot of grapplers suffer from a lot of low back pain. Now, there's a couple of different reasons that could be it. Most of the time, we have hip issues, all right? So if you're having mobility hip issues, your back is gonna overload and take on all the extra weight it's not supposed to. You may find this in bridging and so on. You may find it in when you're going into shoots or takedowns, things like that for a shot. But either way, you might have a hip mobility issue. So I'm gonna show you a simple test for internal hip rotation, okay? Internal hip rotation is when my knee goes down but my foot comes up, okay? Poor internal rotation will cause extra stress on knees, where you see athletes blow their knee out, or like I said before, extra stress on the lower back, okay? So here comes a simple test that you can do, and I'll show you a fix to help you increase that range of ability. All right. Okay, we're gonna get into a 90-90 stretch. I'm gonna make sure that my feet are completely even with my knee. My foot's not back out right here. All right, this leg doesn't really matter, it's more for support. I want to pick this leg up off the ground. And there's a couple of different ways we can do it, but this is just a simple test. And as you can see, it's not coming up much, okay? If that's one of your issues, that's a telltale sign right there that you have poor mobility and internal hip rotation. So I'm going to show you a simple drill, regardless if you don't have any bands or anything, to help increase that range of motion inside that hip and help prevent you from blowing out your lower back or your knee during competition. All right, all we're going to need right here is a med ball. Now, it can be any size med ball, just as long as it's something we can get our foot up onto, okay? We want to lie with the back leg behind, our foot placed on top, not up with my ankle on it. I want my foot on the ball. I'm stretched out, knee is in line with my hip, and I'm gonna simply dip my knee towards the ground. Only go as far as you can need to. Do not over push this, okay? You should feel a slight pinch in the hip and then come back up. You can do 2 sets of 20 like this on each side, or you can hold it each one for 20 seconds and then come back up.